Hi, everyone. Thanks for stopping by. We're going to get started in a couple minutes, but a reminder to have, if you have available some materials, foam roller, bands. I've got a loop and a straight band, any type of massage ball, like a lacrosse ball or a tennis ball. And a towel. If you have access to any of those, now's a great time to grab those. We'll get started in a minute or two. All right, we're gonna get started. We got a nice intimate group here. Thank you again for stopping by. Today we're gonna be talking about shoulder pain and what causes shoulder pain and then what you can do about it. Yeah, this is the conference room in the West Loop. So it's also apparently our storage space. So I apologize, I tried to clear out as much stuff as I can. But yeah, I'm gonna be using some of this space to demonstrate some exercises and things like that throughout our webinar here. So let's get started. My name is Andrew Yoon, and I'm a PT in the West Loop Clinic here. And we've been open throughout the entire pandemic. We're still open. Masks are currently required in the facilities. And you don't need a prescription if you're gonna stop by, unless you are under Medicare or if your insurance requires it for whatever reason. You can book, phone, online, in person, and our website's right here. All right. If you have questions, please use the chat function in Zoom here, and I'll try to stop. We have a table of contents here, and I'm going to try to stop at each kind of break here to answer any questions that you might have. So I like in our, we've got our small group, so you can have your individual questions answered. Hopefully, I'll do my best. All right. So again, if you have these materials on hand, if you have access to them, please grab them so you can get the most out of this webinar. I have both a straight band and a loop band. but whatever you've got. Okay. So our agenda, we're going to start with a brief overview of the shoulder anatomy. We're going to talk about what can lead to pain. And then once you have pain, what that can result in. Then we're going to go over some exercises to address the changes, the structural changes that come as a result of our pain. And then we're going to touch on posture at the very end. Okay. All right. So we're going to start with anatomy. This is the glenohumeral joint. I guess I should say that the shoulder is a very complex joint. And so, a lot of the times it's tough to diagnose exactly what's going on, as there are a lot of different moving parts. And if there's even like one issue in one of those moving parts, it can over time increase the risk of the system falling apart. I guess that's kind of dramatic, but it can lead to symptoms and from like some small issues in the shoulder. So let's go through some of the anatomy here. The glenohumeral joint is your main shoulder joint. That's the one we mostly think about when we're talking about the shoulder. That's our ball and socket. Okay, so you can see we have our shoulder blade here. There's a small socket on the shoulder blade that our humerus, our arm bone, connects to. Our rotator cuff muscle stabilizes the glenohumeral joint, right? There are four actually. Supraspinatus, infraspinatus, subscapularis, and teres minor. And, because its main function is stability, you can see how important that is in the shoulder. The joint capsule, this is it's a collection of ligaments, and it's filled with fluid, and it helps to lubricate the shoulder. Okay. And we'll talk about, this will come up later. And then we have a bunch of other muscles in the shoulder. As you can see, it's very complex, right? So we have in the back, we have like the traps, we have the delt, and then in the front, we have your pecs, right? That's like the main one that we're concerned with when it comes to the shoulder. Okay, so if you have any questions about anatomy, please get them out. If if we're later on in the webinar and you have questions about stuff earlier, that's totally fine too. Okay. But now we're going to move on to what can cause pain. This is pretty straightforward, right? So, if you have a traumatic injury, that can lead to pain. So you fall directly on the shoulder, like this poor guy, or this is what's called a foosh, F-O-O-S-H, that's fall on outstretched hand. And you can see how the force is directed through the arm and into the shoulder there. Okay, another poor guy, and another poor guy, like getting, like hit, right? And that can, all of those things can cause shoulder pain, obviously. Next, acute injury, right? So that's when there's an injury, right? Boom, I know I hurt my shoulder. It can be something like throwing or other high force injuries, or it could also be like, I tweaked it just by like reaching up for a cup out of my cabinet, or like drinking some water, as we get older, unfortunately, that's, it seems like that becomes more and more common. But yeah, those are all considered acute injury. And then our final cause here is more of a chronic type injury, right? Like over time, we have wear and tear in the shoulder just from using it. We use our arms a lot, and that can lead to arthritis, which is that wearing away of different structures in the shoulder. Or, it could, that wear and tear can lead to, over time, small tears in our muscles. Usually this one muscle, the supraspinatus of the rotator cuff. But, how do I want to say this? So as you can see here, 30 to 50% of people greater than or equal to 60 years old have some form of rotator cuff injury, but 30 to 50% of people aren't walking around necessarily with shoulder pain. right? So what they found is that a lot of people have, if you look at an MRI, they have like what looks like an injury, but they don't feel like they have an injury. And so, in PT, I'm less concerned with what is on the MRI and more concerned with how the client or the patient is feeling, right? So that's common in other parts of the body as well, right? So structures may seem, like they've been injured, but like to the individual themselves, they might not feel that way. But yeah, so wear and tear can present symptomatically with like pain and things like that, but it also might not. All right. And then another potential cause of pain can be poor posture. And next, we're going to move on to the results of pain, right? So, we had our cause of pain, right? We got hurt somehow. Then our bodies will generally try to compensate in some way. And what can happen are some structural changes, and that's what these are, the results. Okay, so this is where we're going to be using our equipment, right, to go over some ways to address some of these structural changes. So pain can lead to tightness in the posterior capsule, or posterior capsule, however you want to say it. That is tightness in the back of the shoulder. That's those ligaments that are filled with, where you have the capsule filled with fluid. The back of the shoulder can get tight. And when that gets tight, everything gets pushed forward, right? I don't know if that's easy to see. I don't know if this is going to help, but our shoulder, you might see a lot of people walking around with their shoulders pushed forward here. It can potentially be as a result of tightness in the back of the shoulder. Okay, and when that happens, everything's like some of the muscles may be a little tighter, some of the muscles may be a little looser, right? And so the muscles aren't moving properly. The mechanics aren't exactly how they should be, to not cause some kind of symptom or irritation with movement, right? So the ball of the shoulder doesn't end up rolling properly in the socket, right? And that can cause pain. So if you look at the diagram here on the right side, you can see that in a normal capsule, there's still space underneath this structure here, and therefore there's no pain or less pain. But you can see on this left one with a tight capsule, as someone's raising their shoulder, they're going like this forward, raising their arm. The bone here actually goes straight up instead of gliding and rolling. And so you get pain. So there are some structures actually that roll in here. It's not necessarily the bones hitting each other, right? This is where your rotator cuff tendon may come through. There's a bursa, which is a fluid-filled sac. And so that can cause pain, right? So how do you know if the back of your shoulder is tight, right? You can see a PT and they can check it out. But you also may just feel tight in the back of the shoulder here. It may feel tender if you touch it. You also may feel pain or pressure in the front of the shoulder, right? Because everything's pushed forward and pressing on the stuff in the front. Or, if you try to reach up or up your back, you may have pain. Okay, so those are possible indications that you have tightness in the back of the shoulder. So what do we do about it, right? We have our cross-body stretch. Okay, so with our cross-body stretch, okay, we're going to be putting our shoulder, we're going to be pulling the shoulder blade back, and from there, we're going to reach across and gently pull, right? The goal is, as you just hold it here, to feel a stretch in the back of the shoulder. Okay, Ideally, you wouldn't have any pinching in the front of the shoulder here, okay? But if you're able, like, play around with it a little bit, and if you can feel that stretch, ideally you would hold it for 30 seconds, right? And then you want to do that 4 times a day. It can be 4 times 30 seconds all at once, or you can spread it out however you want, right? Just try to get to 2 minutes of total stretching. Pull gently. Okay. If you're not able to get that stretch feeling the way, right, I don't want it to be full of pain or pinching or things like that, you can take a lacrosse ball. Let me see if I can find a spot. You can take a lacrosse ball, go against a wall, and place it in the back there, right? And you can roll around on it. You can kind of like do different arm movements, anything that feels good, right? To work on some of that tightness in the back of the shoulder there. Okay. There should be like a little, like you should feel kind of a little pocket where it's tight. Okay. And it should kind of like feel good to massage. Okay. Any questions about that one? A cross body stretch. Okay. All right. Next, pain can lead to rotator cuff weakness. Okay. So if we have rotator cuff weakness, then we'll have less stability in the joint. And then oftentimes the supraspinatus muscle, that's the most often injured one because it's so small and it does so much. If it's weak or if it's injured, the arm's not going to lift properly, right? So we tried, if we have issues with our supraspinatus, we try to strengthen all the stuff around it to try to give it some more support and let it heal. Okay. So how can we address rotator cuff weakness? This is a classic, right? Side lying external rotation of the shoulder, right? So I've got my towel, I rolled it up, okay? And you want that under your elbow. And then you've got a dumbbell. Okay. You're gonna hold that in your hand when you're lying down. So I mean, this woman on the PowerPoint is demonstrating it perfectly. Okay. You want your shoulders engaged. You want the shoulders away from the ears. You want it gently pulled back. Okay. You don't want to be like this. You don't want to be like chest sticking out, right? Gentle pull back. The key is more having the shoulders down, okay? And from there, lying on your side, working against gravity. Okay. You want strengthening exercises to be a little bit difficult. That's different from painful, right? You want them to be a little bit difficult. I like to tell people 6 out of 10 difficult, okay? Because if it's too easy and you can do, you know, if you could do like 30 of them without any issue or any fatigue, you're not going to get much stronger, right? So you want things to be a little bit difficult. Okay, you want to feel like you have to rest after 10 reps. Okay, so that's what I have, 3 out of 10 here. Okay. If you don't have a dumbbell, or you don't have the right size dumbbell, right? Maybe you've got like 10s and 20s, but you can't do 10 or 20 pounds of shoulder external rotation, right? You can take a band. You can do the same thing, side lying, right? Here, let's see if I can do this. I should have gotten a mat. Okay. All right, so you can, oh, where's my towel? You can similarly, right, like stabilize with the bottom hand. Ideally have a pillow under your head, right? But from there, you can do some form of external rotation. You want to feel this in the shoulder blade and or kind of in that posterior capsule that we just stretched or massaged. Okay, that's where you want to feel it. You're strengthening the rotator cuff muscles, the muscles that are on the scapula, the shoulder blade. Okay. If you can't find somewhere to lie down, you're at work or something, you got no time at home, you can also just have your band and pull apart like this. Okay. Right, that should work similarly. Okay, notice that my elbow is not straightening, right? Some people tend to do this. You want to try to keep them at 90 degrees and pull out. Okay, very important, very classic rotator cuff strengthening exercise. Okay. All right, so that's for rotator cuff strength. Pain can also lead to biceps tendon tenderness, right? So so when your biceps tendon is tender, that's usually a sign that your rotator cuff is weak, right? They call it kind of a canary in the coal mine, right? It's gonna warn you because that usually means that, you know, your rotator cuff is weak. It's not stabilizing your shoulder, ideally. And so the biceps, because that also crosses the shoulder, it is going to be taking some of the brunt of the stabilization. It's going to be doing a job that it's not supposed to do. So, right, the rotator cuff is supposed to stabilize. The biceps is going to be like, I'll help if you're weak. And then it starts to be overused. Okay. So if you find your biceps tendon, right, it's usually like a guitar string, right? It runs vertically, kind of like next to your armpit, right? You can strum it back and forth, right? And it might be tender. Mine's a little tender. My left one is worse. I do have a shoulder injury. Okay. All right. So it's a sign that your rotator cuff is weak. So we want to do more rotator cuff strengthening. Okay, so I'm going to give you another way to strengthen your rotator cuff. You don't want to work this muscle to fatigue, right? So don't do like sets to failure or anything like that. But you do want to work it pretty good. Okay, so this guy's demonstrating. I guess I don't also need to demonstrate, but a loop band is going to be around your wrists or your hands, right? If you put it on your hands, I think it's going to be a little bit harder. Okay, so if you need a little more challenge, do that. You're starting just below 90 degrees, okay? And you're going to climb 1, 1, 2, 2, 3, 3, okay? And then back down 2, 2, 3, 3, okay? And I'm not letting my shoulders climb, not letting my shoulders raise, right? I'm trying to keep them engaged. 1, 1, 2, 2, 3, 3. 1, 1, 2, 2, 3, 3. Right. So up and down counts as 1. Okay. Try to do up to 5. Okay. And then 3 sets of that. All right. If you want an extra challenge, you can kind of like do a little C with each one. So you're kind of like letting go some of the slack and then pulling it tight. Right. So kind of like this motion. Okay. So same thing. You should kind of feel it back here or like on the shoulder blade. Okay. So that's another rotator cuff exercise. Strengthening the rotator cuff is going to take pressure off the front of your shoulder. Okay. All right. Next, pain can lead to muscle tightness. Okay. So we also often, like a lot of people say they hold their tension up here. Right? So we're going to work on that. That's your upper trap generally, your upper trapezius. And it usually feels really good to get massaged, right? Like this. Okay, so how to address it? So we have our lacrosse ball and we have, the ability to stretch. So we're going to release with a ball. We're going to stretch, okay, as such. So let me demo this. Ideally, you'd have some kind of corner, right? I don't think I have a good corner wall here, but I do have this desk. Okay. So you can kneel, or you can stand and hinge, right? But you're going to be taking the ball, placing it at a spot that's tight, and you're going to push gently into the ball here, okay, with the top of your shoulder. Right. Once you feel like you're on a good spot, right? Discomfort's okay, pain I don't want. Okay. Once you're there, you're going to do head tilts to the opposite direction. Okay, kind of like a little stretch through the pressure. If you've been to React, you probably know, you're probably familiar with this, right? Some kind of self-release. Okay. I like to say 15 or 20 reps, but you can do more, you can do less. And you can do that a couple times throughout the day. Okay, that should help give you some temporary relief. What will help long-term is going to be more the stretching. Okay. So, right, you wanna, if I'm stretching my right trap, I'm going to stabilize here, right? I wanna keep it down and back, okay? If you can like hold on to your chair, and then you're going to take the other arm and gently pull the other way. Okay. Again, gentle. Again, 30 seconds. Again, 4 times throughout the day. Right. Yeah, forcing a stretch, it's not gonna give you any better results, right? Your body may actually like compensate and like tighten up, okay, as a result. Okay, so try to have nice gentle stretches. That goes with any stretch. All right. So that's your upper trap. All right. Posture. This is the last part of our presentation here today. Posture. So, oh, here we go. So if we have poor posture, right? If we're not changing our posture throughout the day, which is good, you want to change your posture throughout the day. But if we're staying like in this kind of position all day long, for hours at a time, you know, day after day, our body is going to undergo some changes, right? And this is what's called upper cross syndrome or upper crossed syndrome. So you can see that there's an X, right? If you look at the body from the side. And so the ends of each part of the X match. So we have weakness across this way. Okay, so we have weakness in the front of our neck and then weakness in our back. And then we'll also have tightness in the front of our chest and tightness in the back of our neck. Okay. Right, so we want to address that, right? We're going to stretch what's tight and we're going to strengthen what's weak. That makes sense. I think it makes sense. So let's see. Oh, oops, skipping. All right. So a tight upper back. So we have tightness through our thoracic spine, right? Because we may spend a lot of our days rounded forward like this. Okay. Feels good, at least to me, and to a lot of my clients, to open up. So I keep demonstrating things, even though they're diagrams, but you don't want to go into your low back, right? You don't want to be here. You want to be in the mid back and higher, okay? The thoracic spine, okay? You can do this in a chair or you can do it with a foam roller. You can do it at like sitting on the floor along the edge of the couch or bed, coffee table, okay? But support your head, your butt stays on the ground, and you're gonna go back. It's not really a sit-up. Some people like to make it a sit-up. Okay. And I like to find 3 different spots and do 10 repetitions at each spot. Okay. And if you let your head go back, right, but still supported, that can help sometimes with getting more upper back extension. Okay. Okay. So that's one of my favorites. Again, not in the low back, mid back and up. Next, we've got weakness in your back, right? Again, tight, tight, weak, weak, weakness in the upper back. So pull aparts, right? You can do these with your palms up. You can also do them with the palms down. If you go to PT, we can determine which way, or maybe you need both. But they're going to work slightly different muscles. Okay, so you're going to be doing palms up and pulling apart. Okay, like this. Okay, elbows slightly bent. I know some people, I see them do that, like have the elbows bent and then they straighten. And that's not really what I want. Okay, you want them almost straight and try to keep them there like that the whole time. Okay, and if you want to make it harder, say that's too easy, you can grab a harder band or pull closer, or do a harder variation where you start diagonally above your head, right? Shoulders down and back, and you pull down from there. Okay. Again, 3 of 10, easy to remember. Okay. Should be kind of difficult, somewhat difficult. If your form starts to deteriorate, like if your shoulders, as you start doing it, your shoulders start to go up, right? It's probably time to take a break. It means the wrong muscles are, or the right muscles are tired and the wrong muscles are starting to kick in. Okay. Next, tightness in your pecs, right? From sitting like this for too long and not changing your posture, right? So again, stretching, gentle stretching. I can't emphasize that enough. 4 times 30 seconds. Okay. Multiple ways to do it. I love the foam roller one. Okay. So sitting lengthwise on the foam roller, right? Butt nice and low, and then knees bent. Okay. I like having the tip of the foam roller kind of along the bottom of my skull here. Those muscles. You get a massage while you're stretching your pecs out, right? So I'm here, and then I'm lifting my arms to find where I feel a stretch through my chest and my upper arm. Okay. So maybe you'll only be able to get to here. Some people may be able to get all the way up here. I don't think this really makes sense as a stretch, right? So don't come all the way to the top. Or you want to be out to the side somewhere. Okay, again, 4 times 30 seconds. That's a great one. Maybe you aren't able to lie down. Maybe you don't have a foam roller. You can always find a doorway. Or I'm finding some success with this one in the upper right here, where you just kind of like put your arm against the wall and gently turn your body and your head. And you get a good stretch here. Okay. Maybe you feel too much of a stretch with the palm flat. I still can't see. So yeah, you can go on your fingertips and turn away. Okay, nice pec stretch. Okay. Or again, the classic doorway stretch. Okay, literally in a doorway, not just standing in the middle of the room. All right, so that's our pecs. And then I think we're near the end here. Weakness in the front of the neck, also tightness in the back of the neck from, right, having this position, right? You can see that you have tightness in the back, or the muscles back here are shortened, okay? And then the muscles in the front are going to be lengthened, right? And that can lead to weakness, okay? What we want is more strength in the deep neck flexors, okay? Deep neck flexors, not the big guys out here, okay? Those are supposed to help with moving our necks. They're not supposed to help with as much with stability of the neck, right? The deep muscles help with stability. So chin nods, okay? I don't want you doing what this guy, he put an X through it. So that's exactly what I want you to avoid. We want to avoid this type of extreme retraction, right? Extreme double chin. We want to not do that. Okay, we want to do more of a, okay, pull it in and then a gentle nod. Okay, you can do little nods. Okay. You can do them lying down. You can do them against a wall. You can do them while you're driving or at work. Okay, and also you want to just stay here, right? You know, just stay in this position and practice using that position, right? While you're typing, while you're working. Okay. It's just general building good habits and good posture. But again, it's important to always be changing your posture, right? You just don't want to stay in one place the whole time. Okay. But yeah, little chin nods. Okay. Try to get like 25 of them. Maybe once or twice a day. Okay. Again, more of a nod. Less of a retraction. Cool. I guess that is the end. Yeah. Any questions at this time? You can also, I think, raise your hand. If there are no questions, I'll end with my quick plug, but feel free to, like, if you're typing right now, keep typing. Let's see. Yeah, we've got all 6 of these locations. They're still open. We do free injury screens, right? So you don't even have to have insurance or like have your insurance verified or anything like that. You can just give us a call. We'll do a free 15 to 30 minute screen. See if we think that PT will be appropriate for you, or we might just give you a sampling of our treatment, a couple exercises, and be like, hey, like maybe you'll be better in a couple weeks. And if not, then come back in and we'll do some PT. Right, but with physical therapy, you'll have some guidance to help manage your symptoms. It doesn't even have to be a shoulder thing. It can be anything. And you'll also get an exercise program that's tailored to what you need. Right. Again, I would be like testing different strength, and then giving you exercise to help strengthen you and balance you out accordingly. Last chance for any questions. Otherwise, thank you very much for stopping by. Hope you all have a great rest of your week. Great day. Thank you very much.